Tonight, the city of Lagos once agog as all routes.
Be the first to know. CORETV News. From the north, south, east, west, and around Africa, we break the news.
One Nigeria.
Now you can catch all the actions live as the news breaks. We are CORETV News.
Welcome to CORETV,
a 24-hour news station.
This is the circular that forced the enemy to have an interface with the media on the ongoing doctor strike. And expectedly, its leaders are not impressed by a decision they say is targeted at breaking their ranks. Rising from an emergency meeting, NMA is demanding an immediate withdrawal of the suspension circular.
Consequently, it is hereby resolved as follows. 1. Nigerian Medical Association condemns in totality the alleged presidential directive via the Federal Ministry of Health suspending residency training program in Nigeria. Nigerian Medical Association demands immediate withdrawal of the suspension circular and unconditional reinstatement of the so-called SAG resident doctors. Government should show commitment on her part in resolving the current impasse with the Nigerian Medical Association. By all means, any attempt by government to break her ranks as association will be resisted. Rather than abolishing residency training program, government should show more commitment towards improving the already poor funded program.
NMA insists that the decision to abolish residency training program is illegal. It also sent out a clear message to resident doctors.
In the light of the above, therefore, the Nigerian Medical Association hereby directs that no doctor should accept or collect any sack letter or sign any register opened by the government or her agents in the hospitals. For the avoidance of doubt, no medical doctor, no matter how hungry, should pick up any locum appointment with the government hospitals as directed by the circular. Any doctor who flouts this directive does so at his or her own peril.
The government had argued that the doctor strike was not justifiable since it had met 90% of their demands. But the doctors have a different position.
And on the 24-point demands, government said yes, yes, yes. That does not mean implementation. And what has been said by the Honorable Minister that 90% have been met, it is absolutely false. When we expect that an agreement has been implemented is when the end result has been achieved.
The striking doctors said they have no intention to return to work until all their demands are met.
It's a beautiful Sunday afternoon here in Lagos. Thank you for joining us again on Cool Digest, the ultimate news and current affairs program. You saw Kaldo Baby there earlier, chairman of the Nigerian Medical Association, speaking tough and saying that demands immediate withdrawal of dismissal letters given to resident doctors by the federal government. Now, when ASU was on strike for close to 6 months last year, we never knew doctors would be next because many people would say that that profession is so sacrosanct and there seems to be a lot of halo around medical doctors, especially in Nigeria. And because we're talking about the lives of Nigerians, and many were of the opinion that if there are no other patriotic Nigerians, medical doctors should at least be patriotic. Now, it got out of hand when we started hearing about the importation of the Ebola virus disease from Liberia via the a man called Patrick Sawyer. Now, many Nigerians were expecting that doctors would see that good reason enough to get back to work and make things happen. But as we speak now, since July 1st, if I'm not mistaken, doctors have been on strike, and so it has been. We're going to play another report for you. It's reactions from that quarters. And when we come back, We'll kickstart the show properly. Don't go away.
I'm not asking for suspension of sponsorship. They are saying they've sacked us. I don't have a job now. The letter says they are suspending the program, and there's an accompanying letter, a prototype that says they should issue to every resident, terminating his appointment. I'm a senior civil servant. You cannot sack me just like that, out of the blue, just waking up from your bed, you say I'm sacked. There has to be procedure. So if in terms of legality, they have committed a big flaw. But this is Nigeria, anything goes. What we are saying is this is what has been done. As a tool for bargaining, we perceive that as a mistake in the principle of negotiation. It will only escalate the problem. Ebola, we are concerned. Let the federal government and the state government try enemy at the federal and state, at national and state levels to see whether we participate. If we don't participate, then we are not willing to help Nigerians. I think Ebola should be an issue that should not be used in this context at all. We have responded when the bomb blast happened in Kano, Kaduna, Yobe. We've shown them that we can go to work and do everything.
The recent announcement by federal government placing all the resident doctors protesting their poor condition of service on suspension has been generating serious reactions from Nigerians. Many feel that the government should have known that the importation of the Ebola virus into the country by a Liberian American has presented an unprecedented health emergency in the country, and the doctors' demand should have been met so that they can return to work. Others argue that the oath of the medical profession does not permit any doctor to go on strike, and breaching the oath is a serious offense that can lead to termination of appointment. A member of the National Assembly, Abike Dabiri Iriwa, says this is no time to toy with doctors' demand.
Whoever advised the president gave a very, very wrong advice. It's going to be counterproductive. It's not going to help us. And it's one of the reasons why our doctors are living in droves to work abroad. So I do not support it at all. And I believe that the president should be magnanimous enough to rescind that decision.
A delegate of the just concluded national conference, Anya Anya, stressed the doctors should understand clearly their essential service role in the society and should not resort to the use of strike as a tool in resolving face-off with government.
I understand how the doctors feel. However, we're in a national emergency. They took an oath to save life. And when you get to the point where it's a matter of life and death for the millions of Nigerians, no doctor has the responsibility, unless he's irresponsible and amoral, to say he will not give his service.
Chairman of All Progressives Grand Alliance Party, Victor Ume, encourages government and the striking doctors to find a quick resolution to the face-off in order to guarantee a healthy society.
Doctors, by their training, are not supposed to go on strike. If you are a trained doctor, you must be ready at all times by the ethics of your profession to save lives. You cannot say that you're a doctor because of pay. For example, you allow somebody who is sick to die. It's an immortal sin.
It is very obvious that there is a health emergency in the country, with 4 deaths recorded from the Ebola virus and several others still under surveillance for the disease. Government and doctors should come to compromise to save the afflicted ones.
Okay, let's get to business now. I'm joined by the second vice chairman of the Nigerian Medical Association Lagos chapter, Segun Akinwotu. Good morning. Good afternoon, rather, doctor.
Good afternoon.
Thank you for joining us in Core Digest. Okay, I'm sure that you took that oath that everyone is talking about, because proponents of that school of thought that do not believe that medical doctors should go on strike are talking about the sacred oath. What is this oath all about?
Well, at the point of you being inducted as a doctor, it's an allegiance to the profession that you carry out your duty to ensure that lives are saved, and then you're able to do what you're expected as a doctor. That's the summary of it. And what more do you want to know about the oath?
No, I would ask if the ongoing strike is not a total objection or fault of that.
When we talk about going on strike, it shows there is some degree of disagreement between you and somebody, And when you now begin to go back to the person's oath, the oath you're talking about was actually made by the Western countries. You agree with me? It wasn't made by blacks. It wasn't made in Nigeria. In those countries, they have almost everything required, the conducive environment to perform, and particular welfare required by those who are in the healthcare system to perform. And all that is required for them to do what they are supposed to do is provided. So when the oath was created, at that time, what was being provided as amenities within the hospitals for the doctors to perform were all fully available. And then what is required by the doctor to be at rest, to be free to do what he's supposed to do. A doctor works, for example, 8 to 4 and continues call after 4. As a medical student, because right now I'm in psychiatry, as a medical student, there was a day I was in the obs and gynae unit. During that call, from morning till night, that surgeon had done 4 surgeries. He had done 2 myomectomies, he had done 1 ovarian cystectomy and 1 CS. He continued the call, and in the night, we had about 4 other cesarean sections till morning. I now closed. At the end of the day, I went to change and come back to my lectures. On my way to lecture, I saw the same doctor again. Doc, I thought you were supposed to go and rest. He said, no, he resumes immediately. After all the 4 CS we did till morning, he said, yes. Because as medical student, you're supposed to observe, and they signed for you. And I said, sorry, sir, how much is your salary? At that time, 45,000. This was in year 2000. I was amazed. Now, if you're talking about somebody has taken an oath, he needs to have allegiance to holding up that oath. The environment within which it works, how conducive is it? If you go to the UK, and I visit my friends there, once they do call, the next day, they are in their houses sleeping. How are you expected to perform well? The patient itself is at risk. That's 1. 2, the amenities within which or with which you need to carry out these activities, with which you need to treat the patients, are they really and readily available? These are matters that you need to talk about.
Well, all these alleged fault in the medical system as it is in Nigeria, are you saying categorically that it nullifies the sacredness of the oath?
We need to understand that we've taken an oath to cater for lives, as you have said. But for example, we refer to the Ebola case. Patrick Sawyer comes into the country, and right now we have a sequelae that has been set up. The sequelae is, right now as I talk to you, as of yesterday, I was at the IDH, there were 5 doctors. 1 was discharged. There are 4 left now, 4 doctors, and 1 nurse, and 1 other person that was said to be a patient in NMPC that has been taken there. Majority are who? Majority of those who have actually, 1, been tested positive for Ebola are healthcare workers, majority doctors. Sequel to that, all other people who have had more contacts and are being under observation, majority are also health workers. So if you are talking about you having allegiance, at some point, when we started this talk about Ebola, NMA requested for volunteers. We had a meeting because of it. Doctors volunteered. We sent them to the required quarters, the Ebola Emergency Response Unit Committee. They went there and, okay, what's going to happen? There were no gadgets on ground to work with.
Before we get there, let's try to...
Are you trying to say that the doctor is expected to now, without required personal protective device, go ahead to have interaction with the Ebola patient?
Just a minute.
Considering the fact that...
Before we go into that, let's try to clear some ambiguous terminologies. Okay. The federal government said it has sacked 16,000 resident doctors.
Yes.
Does that mean there are only 16,000 doctors in Nigeria? Who are resident doctors, and what's the residency training program all about?
All right. The residency training program is a postgraduate medical training, and it is a training that gears you towards being a specialist.
Okay.
The world entirely has gone to specialization. We don't just have medical officers, medical doctors, and then that's general practitioners. Whatever condition you have, I'm sure in your field too, you have subspecialties. So we are also having that kind of training. So you're already a doctor and you're working, but you're trying to aspire to be the best in your field in a particular subspecialty. Now, residency training in Nigeria takes place in mostly tertiary hospitals. So we have in the federal government and the state government. And right now, those that are in the federal government institutions are the ones that were sacked.
Okay.
Yes.
So it means that there are not just only 16,000 doctors in Nigeria. That's what I want to clarify.
They are not just 16,000. It's the residents who make a chunk, a majority of the doctors in the tertiary centers that were sacked.
So why was these people pinpointed out of the
I am still wondering why, because primarily the strike was called by the body of doctors, the Nigerian Medical Association. And then somewhere along the line, we just got to see that the federal government has said it has suspended residency training in Nigeria.
But the strike involved every other doctor in Nigeria?
It involved the consultants, the residents, and medical officers. So all doctors in Nigeria were involved on the strike. So I'm wondering why there was that target at just this group, which form a chunk of the doctors in healthcare system.
All doctors except private owned hospitals. And there's been allegations also that many of these doctors that work with government hospitals also own their own private hospitals. So it seems like a gain-gain thing for doctors in Nigeria.
I beg to disagree with that. Many doctors, you see, when you are doing residency training, it's very cumbersome. Apart from the number of patients, like in my clinic, I see as many as 100 to 120 patients. At the time you're done with the clinic and you're also on call, there are new other patients coming. You're fagged out. And then it's a full-time thing. And it doesn't really give you room to do any other thing. Maybe those who may have had hospitals inherited from their parents may have hospitals they go to after, but you wouldn't be able to do that during the course of your normal work. In psychiatry, for example, you sit at the emergency to see a new patient. One patient you see, you may spend like 2 hours because it's very detailed. And so how much time do you now have? You see like 5 patients in the course of the day. You are fully tired.
What exactly were the issues? Why did doctors go on strike?
Thank you very much. I actually, since last year, a number of issues, have been coming up. And the ones that now actually heralded this current strike fully. One, there had been warning strike since last year. There have been letters to the federal government telling them that certain things are not going right. One of which is they decided that any allied health worker could also aspire to be the medical director. And that was given an assent to by the ministry. We believed you have done that to cause chaos in the healthcare sector. The act establishing the teaching hospitals stated it clearly there that it's only those who have medical background, who have medical primary training as doctors that are to be the medical directors of hospitals. But then some people now decided to, okay, we can go to court, and it's as if you were trying to get a backdoor arrangement to get other health workers to head the hospital. In the course of training, doctors are the only ones. In my training, I did 5 years of pharmacology. I did it from 200 level to 600 level. I did laboratory science for a whole year, which involves all aspects of the laboratory. And then other sub-aspects of medicine. We have the training to be able to have a holistic idea of what it is. So when it comes to running a hospital, you need to have that fundamental background to be able to carry that out, be in that office and carry out the duties as it's supposed to be. But unfortunately, we have people who just feel, I went to school, I wanted to be a doctor, I couldn't aspire to be one, I couldn't pass JAM to study medicine, I studied other courses, but I still want to achieve my dream of heading a hospital. which I think if you really want to do that, you should try and go back to a medical school and then aspire to what you want to be when you have the required credentials to be that.
Well, in line with that, there is also this perception that doctors seem to have this larger than life, view of themselves, because even all their health unions, some of them did not support the NMA in this ongoing strike. How do you react to that?
They would not support NMA. They are the ones that are also aspiring to shift the seat from the doctors.
Why must he be a medical doctor heading hospitals?
That's what I just explained to you now. We have fundamental training and background to be able to see the hospital in a holistic manner. We are the only ones that have that training. And while that is said, that's the medical director. We have the director of administration. So that there's somebody else who is a non-doctor who is also involved, or who is also involved in running the hospital.
What are the other issues?
The other issues also relate to being a consultant. Okay. Some have come up and said, well, we've reached our peak in our career, so we should be called consultants. In the curriculum of employment in tertiary hospitals, only the doctor's appointment is stipulated there that can be given the office of a consultant. And that's when patients are registered in the hospital, they are registered under a consultant, which is the doctor. So when you now say you want to be a consultant, we begin to wonder what is happening. You have a consultant doctor already. You want the pharmacist, he wants to be a consultant. The nurse wants to be a consultant. The laboratory technician also wants to be a consultant.
Okay.
If that happens, the doctor writes a prescription, believes this laboratory investigation should be done, believes this drug should be given, and then this nursing care should be done. And the nurse says, no, I'm a specialist, I'm a consultant myself. You don't give me instruction. Then the lab says, no, I don't think this patient needs, this is the diagnosis. It's a doctor that's really, really trained to know a diagnosis. But because you think you are now a consultant laboratory scientist, you don't think this investigation should be done, or you think others should be. You understand what I'm trying to say? At the end of the day, there will be confusion.
I want us to quickly browse through
There will be confusion in the sector
because of time. Are you saying there are no issues that relate to remuneration?
I'm coming to that.
On the table.
If we say issues related to remuneration, as I said, in what you've just said, we don't want anarchy in the sector. So that's why these other two issues I mentioned earlier needed to be sorted out.
Okay.
Yes, government tried to sort it out, that just the doctor who has that basic training that can head the hospital. But there's another clause there in the circular they gave. The clause they said, I think number 3 clause, said, even if this will happen, it will be at the discretion of the Federal Ministry of Health. We're not comfortable with that. There are roles, there are certain processes you go to be a consultant. You understand? So there are processes that you need to have. There are things you need to do, to give you the wherewithal to be a medical director. So we don't want any ambiguity in it. That's why they will tell you some of them were answered. They've actually met some of those demands. But there were some of them that had clauses. For example, there's a COMMES payment schedule for doctors. There's CONHES for other health workers. That's another demand. That's one of the other demands now. Now, the CONHES, you have certain level grade when you have your entry point for a doctor. You have entry point for other health workers. The thing there is, doctors are on CONMES. By the time we went and said, no, the doctor as a house officer should start at CONMES 1, step 1, because it was below that before. By the time we were requesting for that, by the time they went to the ministry and came back after negotiation, it became CONHES. CONHES is for payment of other health workers. Okay. So what we're saying is, you are now taking them to a different payment schedule entirely. We now say, no, go back, revert it to CONMES. It is same level, but we want it documented, because we don't want tomorrow whereby if the house officer who are doctors are paid the other health worker scheme, tomorrow you will now say residents too, come to CONHES. You now say consultants, CONHES. After all, we started it already. So we don't want ambiguity. We want things.
Are there no other better alternatives to address these issues other than going on strike?
We've had, as I told you, these are negotiations that have been on the fold since last year. They've been on the fold since last year.
Because some will outrightly term this ego tussle. And
okay,
for over 1 month now, you agree with me that there are people, there are average Nigerians who could not afford private hospital who have died as a result of the ongoing strike. Many are asking the moral justification of having people die at the expense of
You've asked for
issues.
reasons why we're on strike. There are other aspects.
Just a minute, Doctor. I'll have to hold you for a while. I'll have to hold you for a while. We'll take a short break now. I understand that you also want to participate in the ongoing discussion. When we come back after this break, the phone lines will be on the screen for you to call. But that'll be after the top of the hour news. That's Core Digest, exclusive to CORETV News. Don't go away.
You can now watch CORETV News live from anywhere in the world on our website www.coretvnews.com. Click on Live TV on our website and watch us live.
And welcome to CORETV Primetime News.
To follow us on Twitter, click on Twitter icon on our website. On Facebook, click on the Facebook and YouTube to see all our previous news production. You can also watch us live on YouTube. Click CORETV, leave a space, then news. CORETV News, a 24-hour news station.